Michelle asked me to elaborate on the cold spray test. The cold spray test is a fantastic adjunct to the sensory collapse test or scratch collapse test. So the idea is as follows. Where a nerve is entrapped, patients have an area of, for example, in this area over the lacertus, or the carpal tunnel, or the cubital tunnel, or any other area really. They have an area where the skin is hypersensitive, even if they don't feel it, they're not aware of it. And so when you scratch, or when you just blow on it, or you just vent it, basically it causes a stimulation of that hypersensitive skin area, and it causes a reflex in the upper extremity that shuts power down for a few seconds. And that's basically what the scratch collapse test is. So it's a very useful test to determine where the entrapment is. I don't see it as a screening test. It's a diagnostic test, meaning once I have a good idea that there's a problem somewhere, then I will use the sensory collapse test to further document and assess where the entrapment is. Now, if I numb the skin with the skull spray and I perform the sensory collapse test again immediately, then a positive scratch collapse test turns into a negative scratch collapse test. At this point, so that means there's no loss of power when I scratch or when I, stimulate the area. And then after this, I can warm the skin again just by rubbing it for a few seconds, and then I will test I will test the power again to make sure it has returned, and then I would perform the scratch collapse test again, and then then it will be positive. So basically, I had a positive scratch test that became negative with the cold spray, and after warming the skin, the scratch collapse test becomes positive again. So I think that's very useful to not only confirm your findings, but also to help silence certain areas where the scratch test was positive, so you can examine other areas. It also is great to help the patient understand where their problems are. In particular, in cases where the nerve conduction studies are going to be of limited help and use.